Hello.
Hello. Dean should be coming on, hopefully soon, or maybe he's waiting in the waiting room. I'm not sure. Hello.
Hey there, David. How you doing, buddy?
Good, thank you.
All right.
Thanks to both again for helping make this happen. So really appreciate it.
Yeah. We're a little bit early here jumping on, so people probably won't jump on until just before noon.
Yeah, no worries.
All right. Well, you guys get a drink, get your coffee, get your tea, get your lunch, get whatever you need. I'm going to do a couple things and I'll be right back when we're ready to start.
Okay.
All right.
Can I get permission to share my screen for a presentation?
Oh, Rick, you're muted.
I'm sorry. Yeah, Robin, if you can make them both co-hosts, that'd be great.
Sure.
Thank you. You can make them co-hosts and still keep up the flyer.
Okay.
Yeah.
Awesome. Well, then I will go fill up my my coffee cup.
All right. See you in a minute.
How's my audio? Is it clear or choppy?
Yeah, I can hear you, Dean.
Good.
Thanks, Robin.
You're welcome. Just 4 so far.
I'm going to switch to the phone audio because my internet connection runs a little bit more smoothly.
Okay.
So let me make that switch real quick. Okay, is the audio still good?
Yes, I can hear you.
Great, thank you. The best way to make sure your internet runs better is to take the phone off the bandwidth. So one of the early tricks I learned.
Do we know approximately how many people might be joining us today?
So
You're-
yeah, Tanya was going to reach out to you this morning. I don't know if she got a hold of you, if you checked the emails, but we had 5 people signed up, I believe, as of this morning. So we did, we had it all over social media and everything. And then I had a board meeting this morning, so I announced it to the board members. I resent them the link this morning. I sent it to all the chambers again. So North County, East County, South County, and Coastal, just for people to be educated. But I don't know, there's a lot of Zoom things going on.
Right?
It's yeah, it's also not the most sexy
Right,
conversation.
right.
Right.
Yeah. No, I hear you.
I would.
I think it's really important. And we are recording this. Is that correct, Robin?
Yes.
Yes.
Yeah. So, worst case scenario, this is still very important and we would love to edit it, if need be, and put it on our YouTube page so that people can watch it again. Just like we had our EC Honors event last month and we did it on a Saturday night and live, we had probably 75 to 100 people watch, but since we put it on YouTube, we've had 285 people watch, which we know is more than 285 because they're watching it with family or friends. It's an
Right.
award show. So same kind of thing is, we could definitely get the word out. It doesn't always have to be live like this as we're recording this, the people that are on, great. And then we can edit it and go ahead and continue to share because this is important information that needs to get out there.
Yes. We're going to put it on our webpage as well with our YouTube
Awesome.
link. So
Awesome.
that'll be further presentation material.
Yep. No, absolutely. And this is, very informative and very educational and people need to know more about this.
Yes.
Mm. right. So it looks like a few other people that registered haven't checked in. But David and Dean, I'm not sure if you want to wait a couple more minutes before we get started.
I'll leave it up to you.
Okay, well, I just want to be respectful of you guys' time too on the presentation.
Yes. Okay.
You want to wait for just a couple more minutes and then we can, I know that sometimes it's a
I
little
think
bit.
people have gotten to where Zoom is like watching a TV show. They don't turn it on until it's time for the actual show. Miss the opening sequence.
If it's anything like me, I sometimes forget to put it on my calendar, so I have to go back and look at the email or find the email and find the link. So
Mhm.
appreciate everyone being here. Okay. Should we go ahead and go, Dean?
All right, let's go.
All right.
Okay.
Good afternoon, everyone. My name is David Shorey. I am the program manager for the Institute, if I could say the word, for Public Strategies, working in the East region. I want to thank you for the Chamber for allowing us to do this presentation. And I'm going to, without further ado, turn it over to Dean Ambrosini, who's our prevention specialist, who will not only talk about today's topic, but talk a little bit about IPS and the work that we do. So Dean, all yours.
All right, thank you, David, and thank you to the Chamber for hosting us today. This is a very important topic that really, frankly, needs to be discussed far and wide. So I'm pleased to be here. I'm going to go ahead and just bring up my screen sharing real quick. Right. Oops. Okay. Let me make one more switch here. All right. Switch my audio off. There we go. So I don't have the duplicated sound. Okay, as David said, I'm Dean Ambrosini, and I'm with the Institute for Public Strategies. The topic today is fentanyl, changing the focus with community-based solutions to combat overdose. Okay, and just to give you a background on IPS, Institute for Public Strategies is a prevention provider for substance misuse prevention in San Diego County. We have 2 contracts. One is in the South Bay, one is in the East Bay, which is where David and I presently work. And the map in the lower left corner gives you an overview of our area. So a very far-reaching area, which is largely populated in certain areas and sparsely populated in others. And just to give you a background on Institute for Public Strategies, we're founded in 1992. We recently underwent a leadership change with a new CEO and a new vision for our work. Our core values are equity, diversity, empowerment, systems change, results, and integrity. And you can see those here in our policy model, our community transformation model, as we call it, or our ACT model. And it shows the various areas that we work in to help attain the change. IPS works in a different way as far as, handling substance misuse. We don't necessarily just do messaging. We don't necessarily do just the drugs are bad campaigns or anything like that. We work within the community to affect lasting change, to help address the problems at the root of the cause that help to combat substance misuse in our communities. And we use a variety of approaches for that. At the beginning is our community organizing. We work directly with communities to help build strength in those communities and address issues like overconcentration of alcohol licenses and different demographic issues within the community to help breed equity. We also do policy and systems change, which is working again within the community to help bring about effective policies. An example of that is we're working with the coalition right now to help implement a sane approach to the dispensaries for cannabis in the East County and helping people to have voice in shaping that ordinance. And we reach for sustainability. We want these changes to be long lasting and to really have an impact on the community. We do this through data and research. All of our work is extremely data driven, and we put a great deal of work into that. And media advocacy, because we try to get the word out there as much as possible with our countywide media advocacy program and other media outlets within our organization. And equity tops IPS's list of core values. Advancing equity is the fundamental feature of our work. Inequitable community and social conditions are at the root of most health disparities. Expanding equity can transform communities. It's an upstream approach, which you'll hear a bit more about later, that ensures all individuals, regardless of race, income, education, or gender identity, have the opportunity to live healthy, safe, fulfilling lives. Oh, I didn't mean to launch into that so quickly. When I say the upstream approach, it means, as I said earlier, we don't necessarily go directly out with a messaging product. We work within the community. We try to look at the issues behind the issues behind the issues and address the problem at that level. So we have programs that, as I said, address issues like over-concentration of alcohol licenses, which was a big project we had and still running very well in Casa de Oro, which helped to bring about significant community change and build a strong and thriving community there. And by doing that, we were able to clean up some of the blight around liquor stores and help to, educate the community on the importance of that. And we've got a good coalition going to do that. And we're doing an equal project in Spring Valley that's at the grassroots level right now, but it's a thriving project that is working to help build a stronger community there. This is especially important in East County because the unincorporated areas don't necessarily have civic support or a city council or anything that stands as a full organization to bring these changes about. So we get the community involved. They usually come to us, and then we help them to make that lasting change. Which brings us to our topic today of fentanyl. As many of you are aware and have heard over the years, there's been an opioid epidemic in this country. It began in the late 1900s.
Dean, you muted yourself.
Oh, he's not muted. It looks like we lost sound.
Hold on, let me
Oh, there
change
you
my
go.
audio. Okay, is it better now?
Yes.
Yeah.
Very good. Thank you. Don't know what happened there. Technology isn't all that we would have it be. We're trying to move to this virtual world, and it's not moving quite as fast as we need it to. So my apologies if there's any technical glitches. Okay, so just to continue the background, the opioid crisis as we know it began in the late 1990s, and it started with the overprescription of OxyContin by the pharmaceutical companies. They've been held to account for that and have started to curb the influencing of doctors to prescribe that drug. It was really a very concerted effort on their part to increase product sales that they didn't realize the depth of the problem that they were taking on. Opioids, as a long-term pain solution, bring with them the threat of addiction, and that was showing up everywhere. And as that addiction evolved, or as that epidemic evolved, and they stopped the prescription drug overprescription, sentence didn't quite make sense, but still, as they stopped overprescription of OxyContin and other opioids, it fed the heroin epidemic because people who were already addicted were turning to street drugs and they could no longer get them there. And then that epidemic eventually evolved into the fentanyl epidemic, which is where we are today, and it's reached critical mass, specifically in California and San Diego because of our proximity to the border. Fentanyl is a synthetic opioid. It is extremely inexpensive to manufacture, and it is being manufactured in China, imported through Mexico, and it's making its way across the border. A very small amount of fentanyl, as low as 2 micrograms, can be fatal. That's represented by the little white dot on the penny there. You can see it's about the size of Lincoln's beard. And that's a very, I mean, when you consider that amount, it's extremely potent, and it is difficult to control. It's often cut into counterfeit prescription drugs, which are being sold on the street. There are several reports of drugs that are badly manufactured that are showing up. I need to emphasize here that the people manufacturing these drugs are clearly not pharmaceutical geniuses, and they don't mix well. And the problem with that is that oftentimes the concentration of fentanyl that they're putting in these pills to increase their potency isn't consistent throughout the batching. So one person can buy what they think is a regular pill, similar, and in fact, that can actually contain a lethal dose or better of fentanyl, because it could in fact be the entire concentration of the fentanyl that was put into the batch. A police officer recently likened it to that time you're eating a cookie and you get one lump of sugar in there because you didn't mix it well enough. It's that kind of a phenomenon. And as I said, we're not working with high quality control levels here. And what's frightening is that fentanyl is now showing up without rhyme or reason in various street drugs. It's being used as a cutting agent in cocaine and methamphetamine as well, which seems counterproductive to put it into a stimulus, but we're not dealing again with pharmaceutical level intelligence. And just to illustrate the impact of fentanyl in San Diego County, this is an overview of the evolution of the epidemic. Fentanyl has been around for a while. It is normally used, because of its potency, it's normally used for hospice care and end-of-life care. It's usually in the form of a patch, and it is also used as an anesthetic. It is not generally ever prescribed for any purpose other than that, and it is rarely made available to the public. And as you can see, beginning in 2000, we had a small amount of 7 deaths, which may or may not have been accidental. They weren't tracking those at the time. Continued to grow slightly through 2009, and then began a reasonable increase from 2010 to 2016. However, from 2017 to 18, when they believed that the drugs started to appear, in the illicit drug market, that really started to climb. And in 2019, well, we went from 92 deaths in 2018 to 152 deaths in 2019. So it's a pretty sharp increase just over that short amount of time. And this shows the same epidemic with 2020 in contrast. And this is why I'm saying that the epidemic has reached critical mass. Between 2019 and 2020, we had an increase of 200% or better, because we went from 152 to 446. Now, these are actually verified figures from the San Diego County Medical Examiner's Office, and the slides appear courtesy of that office because they formulated them and allowed us to use them. As you can see, these are verified deaths of 446. There's another 11 that hadn't been closed at the time that this slide was made. So it is suspected and almost certainty that we had 457 fentanyl overdose deaths in San Diego County in 2020. And this shows the breakdown of those deaths as they occurred in the county. And you can see that there doesn't really seem to be a spike, but it's been a steady increase, with the exception of August, when they did have a sharp increase. So they really can't gauge the street supply on this and how it's happening, but they do know that in most cases it's occurring from illicit drugs bought on the street. So we have had across the board, a considerable increase in 2020. And I'm going to show you a comparison graph. Actually, I'm sorry. Lost my place. Of the 446 confirmed and 11 pending cases, 77% of those were male at 351, and 106 were female. The average age range was 37 years old, but the age range really was from 14 to 76 years old. There's no real, again, rhyme or reason to the way that it's the impact of this. But I think what's alarming is that the age bracket is starting to get lower and lower. 14 is a pretty young age to be experimenting with street drugs to begin with, and it certainly is a young age for overdose deaths. And I think that's where the concern is growing. And if you look at this is a graph showing that the teens here, we have a significant problem. And then we have, of course, the breakdown all the way over. And those in the higher age ranges could often be overdoses related to actual medical use. But because fentanyl was involved, they're simply listed among the statistics. Okay, so here's our percentage breakdown that we did show some sharp increases here in the other, over the period between 2019 and 2020. And we still have the 457 preliminary total. And we can tell that the demographics shifted a little bit here, where it appears that this is really spiraling out of control. We really can't target any particular populations or demographics because it's spreading across the board. And I think that's what's the most concerning. And here's how those statistics played out. That was a 200% increase in fentanyl overdose deaths between 2019 and 2020, which is alarming, to say the least. And as you can see, we also have a very serious problem here occurring because it is spreading through both male and female users. And this one looks like the same data, but I think what's frightening here is that this is from 2019 to 2021. And as you can see, we're already in trouble here. This is January, February, and March of 2021 when these flights were made. We already have, I wish I could do the math in my head, but we're on target to continue that trend of 200% increase within the county just as it stands right now, because the cases are mounting. Those shown in red are pending cases, but it's been shown through the trend that those pending toxicology reports and final determination as to whether it was accidental or intentional are in most cases shaking out. So what is suspected generally turns out to be the trend. So we're in the midst of an epidemic that is not only scary, but it's out of control, and law enforcement cannot seem to get a beat on it. And that isn't for lack of effort. Plenty of money is being thrown at fighting this. But specifically in San Diego County, because of our proximity to the border, we are seeing a huge influx here. And it's becoming, we've always been a channel for drug trafficking because of the border ports of entry that are nearby. So I did notice this week that the DEA has, the Drug Enforcement Agency through the federal government, has authorized a new strategy to help combat the spread over the border. So they are checking a little bit more carefully at the ports of entry, making sure that they're trying to get a beat on the problem. But it's really grown to the point where I think education is the best factor at this point, and examining some solutions, which is what we do at IPS. So just shifting back from the epidemic to our work at IPS, we meet the epidemic to promote an equity-based solution. As I said before in our upstream approach, we address the factors that contribute to opioid use. And several social determinants impact opioid misuse, which include cultural and racial inequities, socioeconomic factors, and barriers to treatment. And the demographic makeup of East County is extremely varied and extremely broad. We do have several cultures living together. We do have several financial demographics where people are Usually, well, that's basically the makeup of San Diego County. People are either extremely rich or extremely poor, and the middle ground is a bit sketchy in certain cases because we do have an overburdened middle class. So those are the areas that IPS is working to address. And beginning with cultural disparities and communities of color face greater challenges in meeting the epidemic despite the significant impact. And as I said, we're working more from the education and prevention method here because that's really the only tool that can be effective at this point, is to get that message out there and make sure that people know what the dangers are. And that's largely due to a lack of culturally responsive and respectful treatment and care. We have a large American Indian, Native American population in East County in the reservation system. And it is important when we approach those communities to make sure that we do that with cultural humility and respect. And we are working with various agencies in the reservation system to help promote messaging and assist them in their messaging efforts, because the prevention efforts tend to be separate and unequal. We may take something that works for us, but when we take it into the reservation system or into a lower income community, that message may not read quite the same and it may not have the same effect. So we're examining ways to get around those pre-existing negative stereotypes and prejudices and try to help curb this problem at every level. And economic factors influence as well, and that's been a huge issue since COVID. As we've all heard, substance use increased due to COVID. Specifically, many people were, out of work and therefore had time, didn't quite have to check their drug and alcohol use. We have some alarming figures on alcohol use as well, but I won't stray from the topic. As how much it increased during the pandemic of COVID and still is continuing on the rise. And the issue with the counterfeit pills, as I mentioned, is they're incredibly cheap. They are easy to obtain. Kids can get them through social media sites. And that's where we're having the biggest problem, is that we really don't know how to get control of those issues when it delves into the electronic world. But economic resources in general influence health incomes as well. There's technology access that acts as a barrier to messaging. We can't always put something on Facebook, or as we're going to do today, record this video and post it on YouTube. Not everybody has good internet service, and not everybody sees that. And then, of course, even in the best of times, there's still a lack of adequate health care, which creates a barrier to substance use treatment. And the unhoused population is particularly hard hit because substance misuse runs rampant within that population. And because of the various mental health issues and the neglect in reaching that population, unfortunately, the prevention message isn't getting out there. So what we're doing is trying to provide upstream solutions to mitigate those barriers and promote prevention. So we're trying to meet the age, race, and cultural barriers, as I said, by using culturally sensitive messaging when we get into certain areas, where we're trying to translate all of our material, which we've recently done with the countywide flyers for fentanyl. We've made sure that as we're getting them out there, we're getting them out in a variety of languages so that everybody can get the message that this is a really dangerous drug. In addition to that, we're concentrating our efforts on lower income communities, mostly because they have issues with reaching adequate and stable internet connection. They don't always get things online, and when they do, they don't always see them. Pardon me. And then we're also working to break down barriers to treatment, which is one of the biggest issues that we have, by helping to promote awareness of how easy it is to get medically assisted treatment, which I'll refer to later, and how easy it is to get into a treatment program, and trying to get that message out there so that people know that there is help available. So starting with that, we're reaching out to lower income communities and people experiencing homelessness. We've adapted low-tech solutions for those without computers. We're using printed material, strategically placed to increase outreach. We're putting it in libraries because people without good technology often go to the library to use the computer there. And we're also partnering with resource engagement points such as job search sites, food distribution sites, libraries and resource distribution sites, as I said before. And that is done in a variety of two-sided postcards in English and another language to help make sure that that message is heard. And then we're also doing, as I said, increasing the awareness of substance use treatment options. Medically assisted treatment is a bridge to sustained recovery. And I think that that's been overshadowed over the years. When it comes to opioid addiction and you say medically assisted treatment, many people often think of the methadone clinic, which has been a longstanding program to help curb opioid use, but it really comes down to swapping one addiction for another. The newest medications use a product called Suboxone, and Suboxone actually blocks the opioid receptors in the brain so that no matter how much people use, the effect isn't there. And over time, it's also mixed with other anxiety-reducing products to help curb the cravings and curb the use. And when it's done correctly, it's administered with cognitive behavioral therapy and other therapies to help the person actually get sustained recovery. And in addition to that, we're working to increase access to care. As I said, with Casa de Oro, that project is actually now working to fund a health clinic within that area to help bring a little bit more medical care to East County, which we're very excited about. And then we, of course, remove those barriers to seeking care, which is to let people know that it's available. I mean, it's as simple as dialing 3 numbers on your phone and saying, I have a drug problem, help me. 211 can save lives. And I must say that San Diego County's 211 system and their access and crisis line is extremely well staffed and very responsive to the needs of the people they serve. Excuse me one quick second. Sorry, my voice is starting to thin out. I need to remember when I'm doing these Zoom things that I'm not addressing a full room of people, so I don't necessarily need to project my voice clear across the county. But the other thing that we're doing, and that is a big part of our work, especially in the Overdose Data to Action program, which is the program responsible for our opioid outreach, we're working to address stigma. Because stigma is actually the biggest barrier to treatment. You know, no one wants to be viewed as a drug addict because of the negative stereotypes and the negative connotations that come with being an opioid addict. People often visualize, I mean, just when you say opioid addict, you assume a junkie in the gutter. And these are things that we're working to address because stigma really feeds deeply into our systems of health. And it occurs in institutional and structural areas through political will and funding for preventing and treating substance use disorder. That's combined with the lack of access to healthcare, the lack of resources, and the lack of outreach to the unhoused population. So we're working within the communities to help increase awareness of this issue and help to promote programs that help to bridge that barrier. And I will say that, you know, I'm very excited to learn that the county is beginning to embrace the harm reduction system and is beginning to work to evolve their view of the stigma behind drug use, because in the case of fentanyl, we really don't have time to waste, because if we continue on this trend, we're going to have, you know, obviously a higher count of overdose. And of course, the law enforcement and justice system can be equally problematic because they're treating, you know, we can't necessarily treat people who are using drugs as criminals right now. We need to make sure that that's met with giving access to medically assisted treatment and diversion programs to help give them an incentive to get off of drugs. Okay. And, you know, the thing is, as I said, is when we start to look at the stereotypes that we have, fentanyl's really changed the face of everything. You know, people who purchase a pill off the street, are they a criminal that's using drugs? Or are they a victim of a crime? And are they an addict or are they a first-time user? We're finding that those things have been pretty much ripped to shreds because we're learning that most fentanyl overdose victims did not knowingly purchase the drug. As I said, it's being laced as a cutting agent into different products. And many overdose victims are simply first-time recreational users. And that sadly is what occurs in the case of youth. They're taking something that is similar to what they've seen in the medicine cabinet or simply, you know, looks like a product that they were given for dental pain. And, you know, instead of coming in a bottle from a pharmacy, it's actually coming in a little baggie, but it looks the same. And why not try it? But a recent Sandbag study showed that 68% of adult arrestees who were surveyed stated that they would not purchase a drug knowing it contained fentanyl. And as I said before, the counterfeit pills contain an inconsistent amount of the drug. So even if someone is taking it, knowing that there's fentanyl in it, they may not know how much. And it's also, as I said, present in many street drugs, including cocaine and methamphetamine, which seems that it would counter the effect, but I can't really get behind the marketing strategies to some of these things. Bear with me one warm day and the allergies go crazy. So in addition to this, we're also meeting the age, race, and cultural barriers. You know, as I said, we're applying racial and cultural humility to prevention. We're not just walking into the neighborhood or the reservation system saying, please put up this poster. We're asking them to help us form a poster that appeals to the cultural issues, that hits them where they are. And we're also trying to be aware the war on drugs, which really, whatever you feel about criminalizing drug use, and of course, in certain cases, it should still be a crime. However, messaging from agencies such as DEA or the San Diego County District Attorney's Office tends to turn off some of the communities of color because they've been victimized by the war on drugs with unfair sentencing and various other issues that occurred because of that failed effort. And then, of course, we're also working with teens to craft age-appropriate prevention messages to, again, meet them at their level. And, you know, getting the message out to teens is specifically difficult. They're impressionable, and they're young. And sometimes telling the effects of a drug, as someone, I'm stealing someone else's analogy, but sometimes it comes off as a consumer report, like, wow, this is really strong. I think I want to try it. We want to do that. So we want to educate without enticing or sparking rebellion. We want to stress the seriousness without focusing on the effects. And we also meet them at their level. We ask them, again, what works and have them help craft a message. We're currently putting together a program with NAMI of San Diego to conduct a series of focus groups to help get an effective warning to teens in a method that they can relate to using technology that they're used to using. So it's not just somebody talking down to them or using a scare tactic, which doesn't work. You know, we're also being realistic. Kids are going to experiment with drugs in most cases. And that is a foregone conclusion. That's why we don't want to create the unintended consequence of increasing curiosity, because there are minds sitting in those audiences that are thinking, wow, that does sound like fun. And that can be extremely, well, it increases the fatalities where fentanyl is concerned. So what we do in that case is that this is where I talk about our upstream prevention. We're wading upstream. We're building skills that help kids make better choices. We use youth engagement as our tool to help leadership. Our curriculum provides students an opportunity to participate directly in changes within their community. And other programs to help students gain leadership skills, because it does in the final build strong self-esteem. We encourage personal growth programs to build a healthy self-image. Generally, it's been shown that kids who are, I shouldn't even say children, shows my age, kids that are better equipped to make good decisions, who have a good self-image, who have a healthy, approach to life, tend to be less likely to go beyond the experimentation phase. They tend to have the approach that I know this is dangerous and I probably shouldn't do it. And if they find out firsthand, they're more likely not to go back to that drug, which is encouraging. And we need to continue to work in that direction to help kids make better choices and to work to recognize the use among their peers, because sometimes they relate to their peers much better than they do to their parents. So these programs really do help with stemming epidemics before they start and keeping the tide from, increasing as it goes forward. So as I said in the beginning, we work with community-based solutions, which, other than increasing awareness and exposing you to some facts, I'm sure you're wondering what you can do to help in cases like this, how the business community can rise to meet this challenge. And it is very easy to do. Really, everyone can. By increasing awareness, helping us circulate informational materials, we're glad to provide them to you in a variety of languages. If your business has a resource section, or if you work in a business arena that helps, that reaches a specific group of people, then we have a variety of materials that we can present to you to make available to your customers and people who stop in. And then the other factor is among your friends and among people and all of us as citizens. Substance abuse signs need to be taken seriously and work to intervene quickly. If you know someone with a substance use problem, reach out to them to help. I know that sounds a little bit like a commercial, but really there's no better time to do that. Having any kind of a substance, a progressive addiction to any kind of a substance right now increases that danger of progressing to fentanyl use or using drugs on the street. And all of these things we've seen that once the balls start, when we talk about upstream, when it goes downstream, it tends to hit a waterfall and there's no stopping it. And once those behaviors take root and someone really has a serious substance use problem, then we have something that's out of control and could equally end up among the statistics that we saw earlier. And then also as communities, we need to help foster community growth. And I think that's best done by participating in programs or sponsoring programs to help build youth leadership skills. Sponsoring sports teams, of course, is one way to do it. And, allowing different leadership groups to set up a stand in front of your store for their specific cause, and helping to get behind the community, because those programs do help with leadership skills with our youth. And then also, on the flip side, as we get a little bit older, to sponsor outreach and treatment programs. There are a variety of programs out there that I'm sure would be more than willing to present their approach to treating this epidemic in future webinars. And I'm quite certain that you could easily get them involved in doing that. And you can also, again, sponsor them directly through donations and help to feed that outreach messaging, because that does have some effect before things get out of control. And the last part I wanted to go over is Narcan, which has become a product that really, frankly, really should be a part of any first aid kit. And I know it's hard to realize that, well, when am I going to come across an overdose victim? But, in business situations, you never know who's going to show up on the front and, on the front steps. You never know who might come walking through the door, pharmacies, all these places where people may be. And I'm going to go ahead and play the short video because it gives an overview of what naloxone is. So I'll go ahead and yield to that.
The sound of the video, Dean, it's not playing.
I know, but it's self-explanatory, so I'm hoping that. Bear with me 1 second. I'll see if I can get that to work. Should I share some notes? Oh wait, maybe I need to turn my speakers on. Okay, well, thankfully it's graphic, so it isn't necessary to have the narration over it.
People are dying every day from opioid overdose. Parents and children, friends and neighbors.
People are dying every day from
But
opioid
naloxone can
overdose.
help.
Parents and
Naloxone is
children,
a safe and
friends and
effective rescue
neighbors.
medication.
But naloxone can help. Naloxone is a safe and effective rescue medication that reverses the effects of opioids and saves lives. Activate specific receptors in the body, including the brain, brainstem, and spinal cord. When these receptors are activated, people experience the effects produced by opioids, such as pain relief, euphoria, calmness, relaxation, and slowed breathing. Taking too many opioids causes so many receptors to fill and activate that breathing may become dangerously slow and even stop. This is how an opioid overdose happens, and this is where naloxone can help. Naloxone has a strong affinity to opioid receptors, more so than most prescription opioids and heroin. But unlike opioids, naloxone is an antagonist. This is administered during an overdose. It knocks the opioids responsible out of the way and allows breathing to normalize. Naloxone can be administered through an injection or a nasal spray. It usually starts working within a few minutes and lasts from 30 to 90 minutes. While one dose of naloxone can reverse an overdose, sometimes multiple doses are needed, especially in cases involving extremely potent opioids like fentanyl, or opioids that stay in the body longer than naloxone. Naloxone is very safe in single or multiple doses. It may produce withdrawal symptoms in people with opioid dependence, but it has no abuse potential and cannot cause an overdose. It's important to remember that naloxone is opioid specific. It has no effect on an overdose caused solely by non-opioid substances like benzodiazepines or alcohol. At the same time, people shouldn't be afraid to use naloxone when the cause of an overdose is unknown. If opioids were not involved in an overdose, it won't cause any harm. If opioids were involved, naloxone can save a life.
All right, with apologies for the technological glitches, as I said, we seek to have Zoom keep up with us, but I'm afraid that our need is growing out faster than it is coming. So, that gives you an overview of what naloxone is, Narcan. I'm sure we've all heard of it. And as I said, it's becoming a necessary part of a first aid kit in certain cases, especially in certain settings. Many first aid kits in institutional settings contain an EpiPen, which is used in the rare case of a severe allergy attack or a bee sting or a food allergy, where the person is unable to breathe and unable to get to their rescue inhaler or another product. So this is really becoming similar to that, unfortunately, but still, it is an extremely effective drug. As you saw in the video, it reverses opioid use. It does cause, I can warn you, from having seen a demonstration live, does cause sudden withdrawal, and I've heard that the patients come out swinging. It's a very unpleasant experience for them, but certainly not as unpleasant as succumbing to an overdose. And it has no effect if an opioid is not present. It can't get you high, and the negative effects from naloxone are very rare. And then this is a restatement of how naloxone and Narcan works. Narcan, incidentally, is the brand name for naloxone as it is produced, and it is available in an easy-to-use nasal inhaler. As we heard, the brain has many receptors for opioids, and overdose occurs when too much of any opioid fits into too many receptors, slowing and stopping the breathing. Naloxone has a stronger affinity to the receptors than the opioids, so it strips the opioids off the receptors for a short time, which allows the person to begin breathing again. And who can carry Narcan? This is the cheesiest graphic slogan that I've ever seen, but I like it. Who can? You can. Narcan. I see it on billboards everywhere, I'm sure, one of these days. That anyone can get Narcan. Upon training, a card is issued stating that the person holding naloxone is trained to use the antidote and is legally permitted to carry it. And under the provisions of Assembly Bill 635, individuals who are permitted to carry it, individuals are permitted to possess and administer naloxone in an emergency and are protected from civil or criminal prosecution. So there is a good Samaritan law. If you're in a situation where someone is, overdosing, you're not responsible. The person isn't going to be arrested. They're going to save their life, and they're going to provide counseling for them, which I think is much more important than getting that arrest done. And just to highlight it, beginning in the early 70s, CPR training became an issue. And many of us, most of us, I think, got a CPR card, and we were trained in proper first aid. Well, this is just another augmentation to that. You never know when you could come across someone, and it is useful to have in that case. And in cases within a household where someone is taking an opioid, even when it's only for pain relief, opioids don't break down in the system. They're not metabolized in the same way. And some people are more sensitive than others. And certain people may miss a dose and take a second dose. So if someone is taking, OxyContin post-surgery or post-dental work, it is a good idea to have Narcan handy because, if that person takes a drink, that can really tip the scale. And, the alcohol can exacerbate the effects of the opioids. So it's not entirely out of the question to have it. Personally, I think that if opioids are prescribed, Narcan should be in the bag when you leave the pharmacy. But, we'll let the pharmaceutical companies deal with that one. So it's not, it isn't a product that you'll hopefully ever have to use. You do have to use it. It's a good idea to know how to administer it and how to recognize the signs when someone is having an overdose. And that's easily done through submitting to the training. It's a very short video, and the product is provided to you. They send you a warning card when it's expiring, and they ask if you want more. And it's just that easy to get. And you can obtain Narcan through the Naloxone Distribution Project. That is funded by SAMHSA and administered by the Department of Healthcare Services in the state of California to combat opioid overdose deaths in the state. The NDP aims to address the opioid crisis by reducing the opioid overdose deaths. So we talked about upstream, how we can prevent people from getting into the situation. Well, when that fails, this is your downstream effect right here. This is the end user. And since October of 2018, the Naloxone Distribution Project in the state of California has distributed 601,000 units, and I'm sure that's increased. I don't have current statistics. And they've recorded over 31,750 overdose reversals, and that is significant when you compare that to the people that we saw within our county that have lost their lives to a fentanyl overdose. If you look at that figure and you spread it across the state, then we have an alarming problem that's become critical mass. And if you look at the fact that this has reduced 31,000 of those overdoses, almost 32,000, we do have an opportunity to help stem the deaths from this. And the website is right there. I am happy to provide it to you if you reach out through my email. And that actually brings me to my reference slide, which concludes the presentation. I'll open it up for questions and answers after I give you a chance to see where I obtain my information. And just to let you know, also, which the Institute for Public Strategies, as I said, we're a substance use prevention provider for the County of San Diego. We're funded through the Department of Health and Human Services, through the Behavioral Health Service. And there is my contact information, which I will leave up for a bit. And please feel free to reach out to me or to David, and we will see that you are given any resources or any questions you might have are answered. Okay, let me just go to the chat real quick.
Yeah, thank you.
Sure. I just wanted to speak to the question in the chat. That's the statement that Steve had. I agree with you. The proper education should start at home with the parents and also in our schools. But again, parents don't always know what to say, and kids aren't always willing to listen when that subject comes up. So it needs to be done carefully, and we're working to assemble toolkits to give parents better conversational options to get that, get that message across to kids. So I just wanted to get that, and then I'm going to stop my screen sharing so I can see you all. And does anyone have any questions?
Yeah, Dean, I had a question. I put in the chat that when you were talking about that people who are buying street drugs aren't aware that it's being laced with fentanyl. And I had a recent experience with someone's younger son that I grew up with. That happened to him. How is that pretty much what's happening? That street drugs are now being laced with fentanyl?
It is, and I said with no rhyme or reason. I mean, what reasonable business person, since we're in a chamber of commerce setting, would lace a stimulant with a sedative that's going to kill your customer? It seems to me that there is a hole in the marketing there. But yes, it is. It is showing up primarily in street drugs. And as I said, they're poorly manufactured. You could get the entire batch in one pill, and that could likely be what happened with your friend's son. And that's where I think the problem is growing the worst, is with kids, because they can get it through Snapchat. They can get it through places from people whom they've never seen before. And, as far as having it start in the home and getting those conversations going, now is really the time to do that. And it's always been important to talk to kids about drugs. But again, it really needs to be sensitively approached. And there are several online resources available I can provide you. And as I said, we're working to get some toolkits together and some messaging directly to kids, because we don't want to get them excited about this. We want to get them aware that, experimenting right now isn't just a rebellion. It isn't just, your ticket to be with the cool kids. It can kill you. And that's really why that message needs to go out, as I said, far and wide.
And part of the problem too, Rick, is that you have a lot of folks who, youth, who see their parents taking a oxycodone, or they take a Xanax, or they take something like that. They go to a party, their friend says, "Hey, want a Xanax or want this?" Without thinking that the two might not be related. That one is a counterfeit, one is not a counterfeit, and then they take the medication, they take the drug, and then they end up dying. And so that's a lot of what we're seeing, is that as we're talking about the criminal versus the victim aspect, that oh, my parents take Xanax to chill out, I'll take a Xanax to chill out, kind of a situation. So that's unfortunately what we're seeing a lot of.
Well, I think one more thing to add to that is that when parents see the signs of mental health issues and substance use in your kids, this is the time to take them seriously. There are so many factors that influence that, and there's so much help available to them. I mean, I'm not a kid, you know. I'm in my 50s, a little farther in than I like to admit. But you know, when I grew up in a very tight suburban rural community, and we didn't have problems. And when we did have problems, we didn't talk about problems. We hope they go away. That's over. You know, when people see mental health issues or they suspect that their child is experimenting with drugs at any level, that conversation needs to be had. And it's very difficult to do, but it's so important to do it right now, because that's the way to reach youth. And I think that's where helping to raise healthier kids from the beginning and getting that, you know, getting them into those leadership programs and continuing to do all the things that parents do right. And then just adding to that, you know, being aware of your kids' behavior. If they look sad, you know, don't buy them an ice cream and tell them to buck up, have a conversation, and, you know, and find out if there's something deeper at play there. It may lead to, you know, over counseling or over therapy in certain cases, but that's so much better, you know, than having to find out that there really was a problem when the saddest thing can occur. So.
All right. Any further questions? We got about a minute left. If not, I really like to thank David and Dean for their time today to educate us on what's going on. And as we mentioned before, we're gonna edit this and put this on our YouTube page so that more people can understand what's happening with this, not only throughout East County, but San Diego County and probably throughout the United States as well.
Yeah, Dean and David, thank you so much for arranging this. This was very informative for me, and I appreciate you taking the time.
Thank you for being here.
And as I said, I didn't add, but if anyone would like a similar presentation for any community organization, please reach out to us. Whether it's your Rotary Club, your Lions Club, your kids' Little League team, you know, we'll bring it to their level. But we're glad to help increase this message and let you know what's going on out there. So thank you.
Thank you, guys. And
Thank you.
Have a great, safe day out there. Was there any other questions or any other comments?
Right.
Again, thank you, David and Dean. Really appreciate it. And everybody have a great, safe day out there.
You do the same. Bye, everyone.